Okay, we're gonna start with blood pressure, and I'm gonna put the cuff pretty snug around Cambri's upper arm, with the arrow pointing towards the brachial artery. Okay. And this guy's always a little difficult to see. And then I'm gonna use the diaphragm side of the stethoscope on the artery so I can listen. So before we would take it, I would listen as I blow it up, and I would listen for the brachial artery to stop making any sound at all. I would note that number and then add 30 millimeters of mercury to that before we pump it up. For Cambria, I'm going to pump it up to 160. I've done this before, so I know that that's the number I should blow it up to. And I'm going to use my left hand right over here, support Cambria's arm so she can stay nice and relaxed. And then we're going to start. So blow it up, like I said, to 160. Perfect. Slowly let it out. Good, and the first sound I hear, I'm going to make note of that, that's systolic blood pressure. And once I hear complete silence, so I don't hear anything at all, that would be the systolic blood pressure number. So I'm going all the way out. Cambria looks good, she's pretty much almost exactly at 120/80. It's a little hard to tell while you're talking as you're doing it. Perfect. And then we'll do pulses. So for the radial pulse, I'll use my index finger and my middle finger and take a hold of my wrist on the thumb side. I would take the pulse, I can take it for a full minute, that's going to be the most accurate, but I could do, as long as she doesn't have any arrhythmias, I can do it for 30 seconds and then just double that number. Like I said, if she had arrhythmias, we would make sure to do it for the full minute. For carotid, I'm going to come right under the jaw and be medial to the sternocleidomastoid muscle. So for Cambria, I come onto this side, right under the jaw, just medial. Again, using index and middle finger to feel the pulse. And I don't want to press too hard. She has a baroreceptor in there, and if I press too hard, she would pass out. And then the last bit is ABI. So for the ankle brachial index, we'd use this to see if someone had peripheral artery disease. That's what we're checking for when we do it. And we'd have ankle systolic blood pressure over brachial systolic blood pressure. And if they are below 0.9, then they are abnormal, so we'd be concerned. Heart sounds. So use the stethoscope. So to talk there, I would use this. The diaphragm side is used for low pitch sounds, and you use firm pressure. The bell side is used for, I think I said that wrong. The diaphragm side is used for high pitch sounds and firm pressure, and then the bell side is used for low pitch sounds, and it's used for really gentle pressure. These guys go into the ear canal, so you want them pointing forward, like that. I'm gonna make sure my diaphragm side's on. So I'm gonna use the diaphragm side to listen to the S1 and S2 sounds. And I'll have, I guess I can show it on you or me, it doesn't matter. I'll show it on you. Okay, so over on her right side is her aortic, and we're looking at basically the sternal angle. It's right over to the right on her. That would be S2 sounds are gonna be the loudest here. And here, which would be her pulmonary valve. And then when we come down to find tricuspid is going to be kind of near the fourth rib. This is where S1 sounds are going to be a little bit louder. Yeah, S1. And then down at the mitral valve, which is where S1 sounds are also going to be a little bit louder. Then S3 and S4 are abnormal sounds, but we would listen to those with the bell side of the stethoscope at the mitral valve location. So S3, S4. And then murmurs can be heard with either diaphragm or bell side, and they can be pretty much heard wherever in any of those locations too. Let's see. Oh, brutes. So if I were listening for a brute in the carotid artery, I'm going to use the diaphragm side and go ahead and find the carotid artery just as before. Once I kind of get it in there, I don't want to press too hard, but I do want to be able to hear. I'm going to ask Cambria to hold her breath so I can hear, and I would be listening for like a whooshing sound if there were a brute. I want her to hold her breath so that I don't accidentally mistake her breathing as a brute. Okay, so when we're listening to breathing sounds, we're gonna kind of take you through all the different areas and the lobes that are in those areas. So if I was to listen to the superior parts of the lobes, I'd be here. And when I do that, I'm gonna have her breathe in and out. Good. And again over here, in and out. Perfect. So that would be a cycle of breath in each of the locations, but I'm just going to talk through them now. So those were superior lobes. Then we'd still be here at a superior lobe of the left side, superior lobe of the right side. As we get to about here, we're going to be listening to the middle lobe on the right. Over here is going to still be the superior lobe on the left. And then as we keep going, it's going to be lower lobes all the way down. And then on the posterior side, we can only hear, or we're only listening to superior and then inferior. So I would be listening to superior left, superior right, and kind of come in here. And then after that fourth one, we'd be looking at lower lobes all the way down. So let's see, what else am I supposed to talk about? Lobes, normal breath sounds. So normal breath sounds, at the top near the trachea, you'd be hearing bronchial sounds. In the upper third of the airway or right between your shoulder blades, you're listening to bronchovesicular sounds. And then at the base of the lung or periphery of the lungs down lower, you're listening to just vesicular sounds. I think that's all I need to say on that. Okay. So now we're going to do airway clearance. So I'm going to have Kimberly sit on the couch and then bend forward, flex forward. And when she does that, I'm going to be doing the apical segments of the posterior lobes, or yeah, on the posterior side. Get her hair out of the way so I don't smack her. So I'm going to use cupped hands, really gentle, and we're going to go for 30 seconds here. Good. So I'm going to be up here. That was long enough. So that would be postural drainage position. That would be my percussion. So for breathing techniques, I can talk through ACBT. So the first part of that is going to place your one hand on your chest, one hand on your stomach. You're going to breathe in through your nose and try to just be filling your stomach when you do that. So you should feel your bottom hand push out. And then you're going to exhale. And that is diaphragmatic breathing. From there, you can move into chest expansion, so your hands are going to go on either side of your rib cage. At the lower part, you'll breathe in. Well, I didn't do a good job. Fill your tummy again and relax, and you should feel the bottom edges of your rib cage just push out. And then the last part is a huff cough. So a huff cough involves breathing in really deeply through your nose, filling your lungs as much as you can, and then when you forcefully let out the air, you kind of make it a huff sound. So you're almost as if you were saying the word. So if I were to do this, I would go like that. Good. And then we can talk through types of breathing. So pursed lip breathing, I've heard this described as like smell the roses, blow out the candles. So you can breathe in a couple of seconds through your nose and then breathe out a few more seconds through your lips together in a pursed, like you're blowing out candles. And then and that would be used for patients who are short of breath pretty much in any situation. The diaphragmatic breathing we talked about earlier, that can be used for patients who have hypoxemia, tachypnea, that one's so hard for me to say, but breathing really quickly. And then the paced breathing. So paced breathing is a lot like the pursed lip breathing, except that maybe in your head you're kind of counting to like regain and slow your breath, regain control over your breathing. So it's a similar concept where you're breathing in, maybe a couple of counts, and breathing out through your lips like that. And that one can be used when you're struggling with like overexertion during exercise, shortness of breath when you're doing exercise. And I think that covers everything.